He followed exactly what the doctors told him to do and died from complications of diabetes at 67. They really need health care, but they're getting disease management.
Why can't I feel better? And it's like, well, the doctor didn't believe that you could.
The goal of the pharmaceutical industry is to have long-term customers.
It's just a massive windfall for Big Pharma.
They are so unwell from the drug side effects.
There is no such thing as a side effect. It is a direct effect of the medication.
Type 2 diabetes is one of the easiest conditions to put in remission when it's treated with this three-pronged approach.
You're bringing hope back into the conversation. Welcome. Today my guest is Dr. Salvatore Gorla. For years he ran one of the largest functional medicine practices in America and has helped thousands of people reclaim their health naturally. He's appeared on numerous TV networks as a wellness expert and even spoke at Harvard on reversing type 2 diabetes. Thanks for being here today, Doc.
My pleasure.
I'm excited because your background in Chinese medicine means we get to talk shop a little bit. Yep. Tell me a little bit about your journey. How did you go end up being such a type 2 diabetes natural health expert?
Well, I think it started back. I did my undergrad in clinical psychology, and I watched my grandfather, who was diagnosed with diabetes early 60s, and did the pharmaceutical path and ended up having strokes and heart disease and kidney problems and died from complications of diabetes at 67. So I remember thinking to myself, how was his outcome so poor? But yet he followed exactly what the doctors told him to do. And that stuck in my head. And then I finished my clinical psych and did pre-meds, and I never wanted to be a surgeon, but I wanted to practice medicine, but I didn't want to chase symptoms. So I looked at, effectiveness of the pharmaceutical model, safety of the pharmaceutical model, and decided I didn't want to do that. So I went and did my MS degree in Eastern medicine, did postgraduate degree in naturopathic medicine, and then, developed this large functional medicine practice, then went back for my doctorate in Eastern medicine, focused on evidence-based internal medicine. So it was a long journey, and during that whole time, did all my CUs in, blood chemistry and advanced blood chemistry and functional medicine. So the practice just continued to grow and grow and grow. It's actually a fantastic job, and it's amazing. The reality is that I think one of the key differences between, functional medicine and corporate dictated conventional medicine is we're always looking at why can the body not heal, and removing barriers so that the body can heal itself. That's what it's designed to do. So I think functional medicine asks the key question of why do you have, say, type 2 diabetes versus, oh, you got type 2 diabetes. That's the what. If we can get at the why, we can get people healthy. And it's a totally different perspective, and it offers people the ability to be free from their type 2 diabetes versus managing it.
Yeah, that's the huge distinction, right? Is like one of the things that I was shocked when I was in school was I learned when you could, just like your grandfather's story, you could do everything right managing type 2 diabetes and still have massive complications and have things go horribly awry.
Yes, and in my webinar, I cite a lot of the research where mixing diabetes drugs, and some of these research is not on. There's one article from Journal of American Medicine from 2019, and the name of the article is Common Diabetes Drugs Associated with Increased Rates of Stroke and Heart Attacks. Now, these are not people on 4 or 5 diabetes drugs. They're on 2. So what people are not told is, what about the whole issue of medication safety? That's often not looked at. So sometimes, we get into treating of symptoms can be dangerous. Managing with certain combinations of meds can be dangerous. But I would find they're never told anything really. They're just, take this, try this, take this. That does not empower the patient. And I think that the model of corporate dictated care is really a model for managing, and it's really set up for efficiency. This is a big problem. It's not really set up for safety. It's not really set up for empowerment or resolution of a condition. It's set up for efficiency for the providers and for corporate income, and who suffers is the patient. And, it's well known that whether we look at Bloomberg Health Index, we look at the World Health Organization, all these massive studies, right? There's another one called Commonwealth Fund, and they say the same thing over and over. Americans, we pay the most, right? We pay the most, but we get the least. Our outcomes are the poorest. So who's the winner in that model? Corporations, right? Big pharma, big insurance. Who suffers? The patient. So I saw it so much over the years. And evidence-based, this three-pronged approach I've developed for type 2 diabetes, it's safe, it's evidence-based, and it works fantastic. So why not help more people?
Yeah, I got my journey started in all this when I was 19. I was diagnosed with ulcerative colitis or Crohn's disease. So having terrible symptoms. And like the day of diagnosis, the doctor was like, it was basically like, congratulations, you have this disease, you're going to have it forever. He literally was like, you and I are going to see a lot more of each other. At best, you'll take medication for the rest of your life and maybe you'll be able to manage it. And like, I'd never been sick before, and I was just like, this is insane. Yep. This is insane. Took me years to like unravel the sort of the hex of a diagnosis, And then I finally like realized like, holy shit, like there's a totally different way to go about this. And like, why is the bar set at best managing this? Like there was no conversation around reversing it, eliminating it completely.
Correct.
Managing it without medication. And then when I finally, got like feeling good, the doctor was, I was obviously on like my fourth doctor. I've been fired by doctors in between because I wouldn't do what they said. And he was just like, well, I was supposed to tell you to keep taking medications that you're not even taking. And, and then he turned off his like dictaphone and his medical notes. And he was like, just keep doing what you're doing. Like, congratulations. Off the record, congratulations. You know what I mean?
Yeah. Well, that tells you something right there.
Yeah. And that's and so I see what to me looks to be the same thing in the type 2 diabetes realm. Is like you get labeled and good luck.
Manage it. Don't reverse it. Don't empower the patient. That's not, this is the thing and why so many Americans are so sick too, is that they really need health care, but they're getting disease management. Yeah. And they don't even, they don't realize that. And when you look at why so many people are so sick in America, when you think about it, and I've said this many times to patients over the past 25 years, when you think about a few things, how is a patient going to get better? With number one, right, 10, 15-minute appointments. Number two, the model is, the vast majority of times, is treating symptoms. Number three, it's basic labs. Number four, there's no patient education or nutrition advice, right? So it's like when you roll those four together, how do they get better? Well, that's the whole point. They don't. And that's what every health index says, right? Massive amounts of consumption of pharmaceuticals and yet massive disease rates. So it's not a model that's, it's a failure for chronic diseases, and it's a failure for type 2 diabetes. And the other thing that's very important, I think, to say is how great conventional medicine is for trauma care, emergency medicine. But again, the reason it's so great is they're treating the cause of the problem, right? Somebody's a broken femur, the cause is a broken femur, the symptoms are the symptoms of a broken femur. Internal medicine, type 2 diabetes are totally different, right? So this whole thing of insulin resistance being treated as a sole cause. Oh, you have type 2 diabetes, you're not responding to insulin, you're insulin resistant. Okay, well, those are symptoms. People are not told that either. Insulin surges, insulin resistance, those are symptoms of much deeper problems. And, we've got, multiple things that can cause that. We got adrenal hormone imbalances can cause that. We've got gut inflammation. We've got nutrient deficiencies, right? Poor diet, high inflammation, right? So there's all these other things that are going on. In endocrinology, it's usually called like the endocrine web. So just looking at insulin in isolation that makes no sense. That's not how the body functions. So, it's like treating one little area. And that's also, I think, why so many medications have so many side effects, right? Because they're not working with the intelligence of the body. This is another key difference between functional medicine and Eastern medicine and allopathic or conventional. We want to work with the intelligence of the body and use the intelligence of the body to heal the body, not, just have a leaky roof with 8 holes and just put 8 buckets. That's not fixing the roof. Let's fix the roof. The pharmaceutical model is not, that's not even the objective. It's not to fix the roof. It's just put buckets under the holes. So, it's my life's work, and my staff and I have been doing this for 25 years, and it's fantastic. It's a great job.
Yeah. That sick care distinction is like, it's everything, right? It's just a massive windfall for big pharma.
Yep, that's correct. And, what always drives me is the individual suffering. I mean, the level of management that I've seen in the past 25 years, it's epidemic. And if I had $1 for every time a patient came in and said how frustrated they are, I'd be very wealthy. I mean, the word frustration comes in with diabetes type 2 constantly, because either they're taking multiple drugs and they can't tolerate them, and getting diarrhea or dizziness and hypoglycemic or whatever the side effects are, or their liver enzymes don't look, or they're getting kidney problems. But the level of frustration that you hear from type 2 diabetes, it's unbelievable. It's constant. So that's one of the reasons I decided to zone in on watching my grandfather pass so young and us suffering, and watching that mismanagement and watching the mismanagement of patients with type 2 diabetes is what really put me in a space like to put together this program so I can help more and more people.
Beautiful. I mean, it's so necessary. The numbers of people having type 2 diabetes, and the stories that I've heard, they get diagnosed and, they're given like a pamphlet. They're just like, here you go. Yeah. Like what is type 2 diabetes? Like, what is insulin? What is my pancreas? And then it's like, they're just sort of left to figure it out on their own, or maybe they get a prescription for like metformin or something. Yep. And, Godspeed.
They are really not helped.
Yeah.
They're really not. And the other thing you see a lot, like I've had hundreds of patients who are, prescribed metformin and they can't tolerate it. They just get diarrhea. The other thing that people aren't told, it can induce neuropathies. It can block B12 usage, and then they start getting poor memory, or they start getting numbness in extremities, aka neuropathy and nerve damage. They start getting fatigue and depression because they're not able to bind B12. So even though metformin, I think, is the safest, it comes with a whole host of other problems, and it's still not dealing with the problem, right? Yes, it can decrease insulin resistance, but it's still not dealing with the problem, whether it's, fatty liver, high inflammation, right? Hormone problems, right? Nutrient deficiencies, no activity, lack of exercise, poor diet. It's still not dealing with these other 6 to 8 things that are actually the causes of insulin surges and the causes of insulin resistance. It's still not really dealing with that. So it's still back to the, roof, the leaky roof. It's still putting a bucket.
Yeah. So when someone comes to work with you, what's that initial assessment that you're doing? What does that look like to pinpoint what their cost?
I mean, in private practice, they would fill out, very detailed paperwork and upload their labs or bring their labs with them. And then we'd go over them. But the reality is most people would come with very, very basic labs. So then I'd order more thorough labs to pin down exactly why their A1C was high. It's very interesting that I have found that this three-pronged approach that I've developed is so successful that when people come in, they'll come in their paperwork and they'll write in their paperwork that diabetes is a death sentence. And, they're paying through the nose. They feel like that they're wasting all this money, and their A1C goes up and down, up and down. They're suffering the side effects. And, the reality is with this three-pronged approach I've developed over the past, 25 years, basically, it's very effective. And it's one of the easiest conditions to put in remission when it's treated with this three-pronged approach.
What is talk about where inflammation fits into this.
Well, the inflammation, when we think about inflammation, right, we know inflammation is the root of many, many diseases, either the cause or aggravator. But with type 2 diabetes, inflammation, it can either lead to type 1 and have the pancreatic beta cells die. So the beta cells are the cells in the pancreas that make insulin. So inflammation can destroy those cells, right, leading to type 1 or aggravation of type 2. But inflammation can also cause insulin resistance. So we have an inflammation component to the disease, and there are no pharmaceuticals that deal with that. There's no anti-inflammatories for diabetes. There is no such drug. So we got the inflammation component. We've got the fatty infiltration component, fatty infiltration into the pancreas, fatty infiltration into the liver, and there are no pharmaceuticals that deal with that either. That's another key difference, I think, between functional medicine and Eastern medicine and conventional medicine is, what about, again, promoting health of a system, right, or gland, and optimizing that system or gland so that the body can just heal it, right? That's not the allopathic, that's not the conventional model. So we got the inflammatory component to type 2, we've got the fatty infiltration component, and then we have the whole component of hormones. Now, insulin is a hormone. But the thing about insulin is that you can't look at it in isolation. That's not, again, how the body functions. So insulin can be very, very affected by other hormonal shifts, right? So things like leptin and cortisol and glucagon, DHEA, all these adrenal hormones can affect insulin. Nutrient deficiencies can affect insulin, like sleep problems, stress, and of course, diet. So looking at insulin in isolation of other hormones is not how the body functions, right? In real time. So again, it's taking something that's very, very complicated and go, oh, just you're insulin resistant. Why?
Yeah,
that's the key.
That's the question. That's the question that Western medicine tends not to ask, right? Because it requires time, it requires a lot more education than what they may have learned in school. It's
correct.
A lot of med schools are sponsored by big pharma.
That's correct. Right. And people are not told that either.
Yeah.
That's true.
Yeah.
That's absolutely correct.
And so to unravel that tangled mess takes, expert eyes and a willingness to look at a whole bunch of systems that Western medicine, they're so compartmentalized.
Correct.
That they're not.
And that's another problem, right? You see this specialist, this doctor for this and this for that. Well, that's great for trauma care, emergency medicine. But for internal reoccurring problems, breaking up the body into different pieces is not how the body functions in real time. So, we have this crosstalk between everything from the thyroid to the adrenals, to the pancreas, to the liver, to the gut. So you have to look at all these moving pieces if you really want to put it in remission. And really what putting it in remission does is it gives the person their life back, because diabetes is such a serious condition, right? I mean, we're talking about everything from their limbs to their kidneys, their eyes, their brain. I mean, everything is related to blood sugar. So when I'd order, real lab work on people, it was very interesting. It's called a comp bio screen, and it would be 4 pages of blood work, 5 pages of blood work, and then some insurance are getting 1 page or half a page. But what's so interesting about the labs is that the A1C and glucose would be the first 2 markers, even before the liver, the kidneys, iron panel, cardiovascular risk markers, blood thickness, So why is that? Why is A1C and the glucose the first 2, right? Because that is such a foundational system. The other thing I think a lot of patients are not told is this whole thing of how important glucose is to the brain and to fuel. So metabolic fuel like fat burning, but also that the brain chemicals, right, whether it's dopamine, serotonin, acetylcholine, they all require glucose at some step to be made. So this is why so many people with high A1C suffer from, memory problems and mood disorder and exhaustion or anxiety, depression, because the brain uses glucose in large amounts to make brain chemicals. So as the person is fluctuating throughout the day, so is their mood. And then if they have these insulin surges, then they're right in the fat storage. And then they get the whole, the weight gain. So this is why it's such an important condition to put in remission, not manage. Put it in remission and keep it in remission.
Yeah.
Save your eyes, save your brain, have a good metabolic rate, Save your kidneys, prevent stroke, prevent heart attacks. I mean, it just has this massive impact on all of the body. Another thing about type 2 diabetes, again, that patients are never told, is it could really be considered a long-term insulin damage disease. So, when the cells don't respond to insulin, and insulin is just floating around the bloodstream, it's very dangerous, It creates small vessel inflammation. It can create thick blood. So that's why we get all these small vessel damage things, Everything from ED to memory problems, to numbness, all these things in the extremities, or eye damage, retinopathies. So it's very important to understand what insulin is. It's a hormone, For type 1, it's life-giving. Without insulin, type 1 patients would eventually literally die. And for type 2, it's life-giving. For people who are non-diabetic, it's life-giving. It allows glucose to get into the cell. Then we get fuel. The problem is with these people that are type 2, people are not educated about this, but it's a Jekyll and Hyde hormone. We do not want lots of insulin floating around the bloodstream. We want the person to take a glucose load in. Pancreas makes insulin, The glucose gets into the cell. We get fuel. That preserves the pancreas and makes sure the metabolic rate is running efficiently. What's interesting, though, and this is why certain pharmaceuticals are associated with a lot of dangers, is this whole phenomenon of telling the pancreas, because there are whole drug categories that tell the pancreas to make more insulin. Well, here's the problem with that. That's what refined carbs do. That's what junk food does, and sugar. So they can actually be draining the pancreas, right? Actually converting the type 2 to type 1, and the patient doesn't even understand it because they're not told anything. So we want to make sure we preserve the pancreas and reduce these insulin surges, make sure that that communication is very efficient. And that's part of the three-pronged protocol that I've developed over the past 25 years, right? Which is they reduce the inflammation, we remove the fatty infiltration, the liver and the pancreas, and we restore hormone balance and resensitize the cell's response to insulin. And if we do this three-pronged approach, the person can get their A1C down, keep it down, right? Preserve their brain, lose weight efficiently. Fantastic.
Yeah, that's what everyone wants. Talk about where diet fits into the picture.
Well, I think diet is, one of those things that the thing about type 2 diabetes diet, it's really not that complicated. I tell patients just eat real food. And, eat, lean protein, eat fresh vegetables. Fruit can be a little confusing, right? Maybe they could do some low glycemic fruit, but I tell them, make sure your diet should be lean protein, good fats, fresh veggies or sauteed veggies, like low starch veggies. Grain confuses people. A lot of patients with diabetes do not do well with grain. So the areas that they get very confused, I'd say, would be grain and fruit. And I'm not saying they can't have any grain. Maybe some people can do okay with, maybe some quinoa or wild rice. But if they eat white rice, I've had patients, they eat white rice, and it's worse than that for their blood sugar than ice cream. It just spikes them through the roof. So, what we call natural medicine, we don't want a lot of white junk food. So, lean protein, right? Good healthy fats, fresh veggies, sauteed veggies, low on the grain, obviously all this high fructose corn syrup, seed oils, those are they're garbage. But again, it's not the thing about it. I mean, my family's Italian American. I love food. I love pasta. The thing about nutrition is it's very important to be balanced with the patient. And what I mean by that is, you can't say to somebody, don't do this, don't do that, don't do this. You have to respect their culture. You have to respect, people love food. I mean, food is life, right? So you have to work with them and be reasonable. And by the way, that's also where the nutritional compounds and herbal compounds come in, because if somebody sees a doctor that has passed herbal medicine board and understands human biochemistry and nutritional science, another powerful way to put it in remission that offers them some leeway with diet is doing the herbal compounds and the supplements and nutraceuticals accurately. I had so many patients over the years, they come in, they have bags of nutraceuticals and supplements. They're spending all this money, but they're quality control on them poor. They're not even valid formulas. They're on the wrong herbal compounds. They're on the wrong nutrients. It's a huge field. So you can't ask an allopathic provider, a conventional medicine provider about herbal medicine, nutritional science. It's not what they do, right? So I have done pre and post testing on thousands of people, and I can tell you that nutraceuticals and supplements and herbal compounds, when applied accurately, are incredibly effective, right? With pre and post testing. So it's very important that we do diet with people. It's funny, and I've been in private practice 25 years. I had one patient in 25 years tell me that a conventional doctor discussed nutrition with her, came in, she was in her 60s, metabolic syndrome, cardiovascular risk, weight gain. I'll never forget, once in 25 years, and the cardiologist said to her, you would probably benefit from Mediterranean diet. One time in 25 years that a conventionally trained provider mentioned nutrition. That's a problem. Yeah. We eat 3 times a day. I mean, we're either going to eat to be healthy and give our cells what they need, or we're going to eat foods that are going to inflame us. I mean, again, I don't believe in being neurotic with diet. I really don't. I love pasta. I love my red sauce and garlic. But, we have to eat whole foods as much as possible if we want to have real health, right?
I remember when I was sick, I was lucky. I had the luxury of going to some top medical centers. I was at Mayo, I was at Rush in Chicago. And I remember I asked both, I was like, does it matter what I eat? Right. And I had inflammatory bowel disease, right? I was like, does it matter what I eat? And this one doctor was like, no, doesn't matter.
Even though the food goes right through the gut.
I was just like, even in my 19-year-old brain, I was like, but wait a second. Like if you ask a plumber, does what flow through the pipes impact the integrity of the pipes? It's pretty obvious, right?
It's unbelievable.
Yeah.
But again, it goes back to the model, the massive influences of big insurance, of big pharmaceutical industry, is that the reality is, this is well documented, is that the goal of the pharmaceutical industry is to have long-term customers. That's how it is.
Yeah.
And there's a great book by Dr. Marcia Angel. She was the editor-in-chief of the New England Journal of Medicine. And for over 20 years, she's a medical doctor. And she wrote a book called the pharmaceutical industry, right? A story. It's doctors in the pharmaceutical industry, a story of corruption. It's well documented now over the past, couple decades, that it's this whole move in corporate America in the medical field to develop long-term customers. That's a problem.
Yeah.
They should be treated with the utmost respect. They're suffering people. So the idea that they should be turned into customers is not right. What they should be turned into is somebody that doctors are there to serve. And this is another thing I think is missed, is that one of the roots words definition of doctor is teacher. I think that's a very important thing, because you want to teach people, right, how to become healthy, and then teach them how to stay there. This is a key difference between disease management and healthcare. Disease management treats symptoms, right? For chronic disease, just treat their symptoms, ensuring that they never get better. Healthcare, right? First of all, we believe in more thorough labs, for one. But the idea in healthcare is to get the person healthy and then have them stay there by optimizing their weak systems, right? And teaching them how to stay healthy. They're very distinct models. And of course, the results are totally different, right? In healthcare, you're helping people get there, helping people get their A1C down and keep it down for years, right? That's not the disease management model.
Yeah, and to be clear, this isn't doctor bashing, right? There's lots of good people that are doctors. It's a reflection of the system. Who I see, it's a reflection of the system that they were educated. Yeah, exactly.
Yeah, they're under a massive umbrella. I get MedPage 2 or 3 times a week, very mainstream. There's always articles in there on the broken system of American medicine. It is a very broken system. As far as the results that are achieved with just the pharmaceutical model, it's a disaster statistically. Yeah. And we have epidemic rates of almost every disease as far as chronic diseases. So, it has nothing to do with bashing. It's just a fact, and it has more to do with, in my mind, of how do you really help people, yeah. Right? The corporate medicine is just that. It's corporate dictated, right? Between big pharma and big insurance. And it just has the whole idea is to manage, not put types of diabetes in remission, not reverse it, right? It's not very empowering to the patient. And it can come with a whole slew of other problems.
Yeah, this is reminding me of a book that I read years ago. I hope I get I think it was called Hope. If I'm remembering it right, it was basically a book about hope and basically the health outcomes and the quality of life when people have hope. Yep. Versus when they don't. Yep. And that's why I'm so passionate about this podcast in particular, and it really amped up talking to you, is because you're bringing hope back into the conversation. And we got so frustrated in my own experience, and then as a practitioner for 20 years, listening to people's interactions with typically allopathic medicine, they kill hope.
Yep.
There's no hope. And when you kill hope, then you take someone away from the dream of remission and getting their life back.
That's right.
Just managing.
That's right.
And
totally different mindset.
Yeah. And then people are like, why can't I feel better? And it's like, well, the doctor didn't believe that you could, right? And it's like the opportunity for hope was removed.
Which is a huge problem. We always want to give people hope. We want to give people evidence. And so,
Evidence-based hope, right? Is kind of what I will.
yeah, I know, that's what I tell people. Let's apply science and a good mindset, aka hope, together.
Yeah.
This whole thing that the whole thing of mindset is very important too, because it's very common with types of diabetes that, they've seen numerous doctors before me, most of them, and they're suffering. And the whole thing of mindset and belief is very powerful. Very powerful. We want to get the person in the right frame of mind, right? So that they, the whole thing of let's just say, it's a spiritual mindset. It's a mindset of, I can get there and I can stay there. Because when you deal with people who've been diabetic for years and they've had drug side effects, and maybe they have kidney problems now or high liver enzymes, or whatever, they've had strokes, and that, they can, and particularly, and then you mix the aging process or maybe stress that we all go through, and, people can get very, very down. Mm-hmm. And of course, we got the glucose with the brain, so they can have those problems, right? So it is very, very important to have an evidence-based system and also help people get to where they want to go with their A1C, but also very important to have them also have a good mindset and help them with their mindset. And by the way, when glucose starts getting into the cell efficiently and they start making dopamine and serotonin and acetylcholine and all this, that inherently helps their hope, because now they have fuel for their brain. So, there's a physiological mechanism as well as an emotional component.
One of the most diagnostic questions I used to ask in my practice was, can you imagine yourself feeling better?
Yeah.
And it was just I wouldn't make a big deal about it. It was just sort of like, to them, it might maybe a throwaway question, but to me, it told me a lot. How severe they were, where their brain was at, and like how much work would we have to do on that mental, spiritual side to even, because, I've lived it. Like when you're so sick, after a while, you're just trying to like survive your day. You're not even thinking about feeling great. You're just like, maybe can I not shit myself today? It's
right.
And so I love that your work pays attention to that, because if you can't imagine yourself feeling better, if you've lost that bandwidth and that frequency, we got to get that back. Otherwise it's like trying to build a house without a blueprint.
Yep. And, the other thing I think is, and it's very common, it's just the amount of side effects that diabetes meds have. A lot of people just can't even tolerate them. Maybe they can take, I can tolerate a low dose metformin, maybe, but once they're on 3, 4, 5 meds, they are so unwell from the drug side effects.
Mm-hmm.
And again, what happens is when you're trying to force, right, instead of having the body repair itself and deal with causes, when you're trying to force physiology and not removing the barriers, right, that are causing their problem. So, it's like the roof analogy. The more you don't deal with the roof, right, the less you pay attention to the cause, aka the hole in the roof, the more buckets you're going to need. And that's the same thing with this pharmaceutical management of type 2. So try this, take that, take this. And then the next thing you know, they've got dizziness and exhaustion and weight gain and diarrhea and brain fog from the meds themselves. So, around and around they go.
I had this teacher at school. This guy was a character, and he would scream in class. He would say, there is no such thing as a side effect. It is a direct effect of the medication. It's as side as like if you get the benefit that you want from the medication, but they're all effects of the medication. And I think what most people, what might be helpful for the audience to know too, that most people don't even realize, is that from what I understand, correct me if I'm wrong, there aren't studies done on the safety of a lot of medications when you are looking at like what happens when you've combined 3, 4, 5 medications. It's too expensive, too much variable, the dosage, the body weight, the whatever. Maybe there's some studies showing when 2 medications are mixed, but like once you start adding a third and a fourth, you are the laboratory, you are the lab rat.
Polypharmacy is very dangerous. Polypharmacy is by definition either 3 or more meds or 4 or more meds. It's a leading cause of hospitalization. It's very, very dangerous. It's no man's land. Drugs.com can be helpful. You can plug them in there. It's what my case managers used to do. You go to drugs.com and you can type in your meds and click interaction. That can be helpful. The problem is if you get a drugs and of course the only doctor's office that does that I've ever come across is us, even though we're not the prescribers. But we, of course, see all kinds of problems there. It's not uncommon for people to come in with high liver enzymes. They're never told. They got declining kidney function. They're spilling protein in their urine. They're never told. Then my case managers would do a drugs.com, and it will say right on there, don't do this. It can damage your liver. Or mixing these drugs can cause kidney problems, but people are not told. That's what I mean. So it's that whole thing of paying attention in healthcare is so important, right?
Can we, I want to ask you about genetics and how much, genetics play a picture. Are you running
in type 2 diabetes?
Yeah.
I think there probably is a genetic component, but I have to say, I think it's relatively small. I don't run those type things. I've never seen them run, but I think there is probably a genetic component to type 2 diabetes, but I would have to say that it's by far and large, right? Much more a hormonal, nutritional, metabolic, lifestyle, nutrition disease, than it is genetic.
Yeah. One of the things that I've come across recently is the conversation around Alzheimer's being a type 3 diabetes, right?
You see that now. Yeah. It's not an official diagnosis, but we know that out of control type 2 insulin surges, ongoing, right? Small vessel inflammation created by insulin surges can create small vessel inflammation. That's why men get ED, and patients get nerve damage and eye damage and retinopathies. They get all these small blood vessel damage, kidney damage. That's all those insulin surges and insulin floating around the bloodstream. So we know that people with insulin surges and ongoing insulin resistance can develop brain inflammation. Definitely.
Yeah. And you mentioned ED a few times, and I think it's important to hit that point. It was told to me that for men, especially in their 40s, relatively healthy, one of the most important indicators of your cardiovascular health and your sugar is do you still get a morning erection?
Correct. That's right. Yeah. Because it's blood flow. Yeah. That's the thing. Anything to the blood flow to the extremities, right? Penis, extremity, right? Feet, hands, brain, all the small blood vessels, are they getting perfusion, right? Are they getting glucose, oxygen, nutrients? And then this goes back to also the reality that, somebody could be on other pharmaceuticals. Of course, they're rarely told this through allopathic model, is that they can be on other pharmaceuticals aggravating their blood sugar. That's very, very common, but they're never told that. Nobody, that's, you can't dissect these things in 15-minute appointments, right? It's in and out, in and out, in and out. So there's a whole slew of pharmaceuticals that can aggravate diabetes and blood sugar issues. So it's fantastic work. There's no other kind of work I'd like to do.
So who's your ideal patient? Who's your ideal client?
Well, my ideal client as far as type 2 diabetes is anybody suffering with type 2 diabetes, really.
Yeah.
Yeah.
That's amazing. Because for context, I've seen a lot of practitioners I only want to work with someone who is newly diagnosed, or, they choose sort of subsets of it. And so I love that you're open to it. And especially even, it sounds like the severe cases, right? It's
absolutely. I've had people come in with A1Cs of 13, 14. They did my plan. They're down to 6 or 7. Oh,
that's incredible.
I've even had some people come in where their A1C, because we work with LabCorp and Principal Labs, that their A1C is that they stop counting above 15.5, so it's have an arrow, right?
Wow.
Yeah, I've seen a few of those. But, here's the thing why I don't why I work with any type 2 diabetes is because if somebody's beginning stage and they apply this three-pronged approach I developed, then, right, let's just say they're pre-diabetic. Well, we put in remission early, keep it down early, save your eyes, save your limbs, save your kidneys, save your brain. Or somebody's A1C is 10 and they're on 4 meds and they got chronic diarrhea and kidney damage. Here's the thing, in my perspective, what does it matter? They're still a person that needs help, right? They still need help. And this is another thing that I discussed in my webinar, this whole thing of pre-diabetes, right? A lot of people are told, you got pre-diabetes. And some people are never even told. It is estimated that, I think about, 40 million people have pre-diabetes. I forget the numbers, but many Americans have pre-diabetes don't even know. So the thing about it, stroke.org says that just pre-diabetes increases strokes. And there's literature from endocrine society groups that say even pre-diabetes increases heart attacks significantly. So a pre-diabetic number, say depending on the lab, it's usually 5.7 to 6.3 is pre, right? An A1C between 5.7 to 6.3 is pre-diabetic. Well, here's the thing, that should not be ignored. That needs to be taken seriously, because even that is showing that person is already under physiological stress. right? So, that's why I say, if people don't understand that, they have to take their diabetes very serious and find an evidence-based plan that is safe and effective. If they don't understand how important it is, I don't think they understand how important. They're not understanding what diabetes is. I mean, people still get amputated, they get kidney disease, they have strokes. I mean, they're very serious things. So I think a lot of patients just don't understand. What is it? What does it mean? What are the consequences that I don't get it under control safely? It's just, again, that's part of the corporate model. People are not educated. What does it even mean, the insulin resistant? Why the insulin resistant? What are the causes of that? Right. We're never told that. I mean, in fact, a lot of Americans don't even know the term insulin resistant. They've heard it, but millions have never even heard it. Right. But they're being treated for it as it's the cause, when in fact, it's a way that people are insulin resistant, yes, but that's a symptom of much deeper problems, and they're never told that.
Yes, they never told it, and then they were stuck trying to DIY it themselves, right? So for like the sappy the patient who knows this problem, but they don't know where to go locally, there's not much help. And so they're stuck trying to sort of figure it out themselves. But then it's like listening to you, the nerd in me is loving this, because it's like, I get the feeling that you're just going to leave, like there's no stone left unturned when it comes to helping people reverse this.
I'm neurotic about it, because I saw what happened to my grandfather. Yeah. And my mom, my own family was suffering. I had died at 67, suffered. It's my life's work. I love it. And, this thing about information, I think we should talk about that. Because here we are in a culture that is with the internet, with so much information you can never even process in a lifetime. But here the thing is, we have massive amounts of information and massive amounts of chronic disease. Information is not the answer. It's not even close to the answer. Because if it was the answer, Americans would be healthy, and we're massively diseased. So information is not the answer. What is the answer is finding an evidence-based plan under a doctor's care that understands the causes of the problem. That's the answer, not just one information. In fact, I find that diabetes patients are massively confused by the internet, right? Because they get different information. So, I should take this, and maybe I should try that. They don't, they're massively confused. The information doesn't help them all. In fact, it usually drives up their anxiety. Because they don't know, they have no idea. Well, I don't know what's specific to me. And then, of course, then you throw them into the mainstream medical model based in labs, and they have no idea. About cardiovascular risk now? Do I have thick blood now? Do I have stroke risk now? Like, where am I on the continuum? Given that, say A1C is 8 or 9, where am I? Right? These things get, insurance does basic labs. It keeps the cost down. So that's the other thing after always looking at those other parameters. Like blood thickness and blood viscosity and small vessel inflammation. Those things can all be pinned down in a labs, because diabetes have those issues. But diabetics have those issues. So, yeah, it's a passion of my team and I. We love it. It's fantastic. We've been doing it for 25 years and going strong. We love it.
Beautiful. I'm fired up. I'm feeling the hope and, for humanity, the whole first for these diabetes patients. Thank you so much for being here. But as we wrap up, is there any message that you might have for someone listening who's got type 2 diabetes, the A1C is super elevated, they just haven't got any answers? Is there anything else?
Well, I'd like to watch my webinar. You can go to drgorla.com or the Diabetes Coach, and you can learn more through my webinar.
Fantastic. Thank you so much, Doc, for being here. Be sure to check him out. Thanks for watching, and we'll see you next time.